Okay, we're going to debunk ear infections for mums so that they understand the ear. This model is perfect for explaining two things. One is that the jaw joint presses up here into the ear canal. And so when children are erupting teeth and there's a lot of movement of the bone, literally the bones have to erupt to push the teeth, which is why they get hot. In the head, they'll often rub there. That will not be necessarily an ear infection, but because it's so close, the jaw is pressing up into the ear canal and can distort the ear canal. It's also when the distortion pushes up into here, can distort the ear, and that's where tinnitus comes from, ringing in the ears, that funny sensation of noise. That will be because the jaw is pressing in and interrupting all the nerves of the fine mechanics of hearing, which is what these little bones do. So waves come in here, they hit this drum, then they go into the little bones in there that feed directly back into the brain. So that can happen from pressure from the jaw, it can happen from wind noise, all those noises too strong. But the great thing about the ear that no one really has ever taught parents is that the ear canal is one single canal with a simple drum in the middle. Now this drains into the back of the throat, so anytime you get a throat infection, it can sometimes close that off, and so pus and mucus will build up. In 90 to 100% of the time, it purely comes from not enough drainage of that. So the most important thing is to check the back of the throat and the neck, because if the neck is out, it sits right in here, and that's part of what will tighten and block all of this muscle draining, the muscle lining of this tube draining into the back of the throat. And so our target is to make sure the throat is clear, because that takes pressure. If the pus builds up, it will burst the drum and come flowing back out this way and possibly get infection in this inner ear area. So as a parent, you can look at the throat, make sure this literally comes into the back of the throat in here. If that's blocked, your core job is to use everything from different herbs and vitamins to dry the back of the throat, to clear it. You can massage it to help unblock this tube like we do when we equalize our ears. It's usually the yawning and the stretching of the throat that helps us. Or if we put airflow through the nose, we can use air to blow out the hole in that area. So it's not difficult to manage the ear. We just have to demystify by saying that the goal is not to put a little cut in here and put a little thimble to help the pus to drain. You've got to get the body working properly again, not just create an ease of, which is his main medical approach, is to put a grommet in there, which puts a hole in that pigskin drum, can affect how well the hearing works, and it lets normal fluid drain out this way, which is an open invitation for more infection. So if as a parent you go, all right, let's check the throat, let's check the neck, let's check the drainage through here. It's a simple tube. It does not need to be a complex issue, and you don't need to be afraid of it or worry about it. So, any questions from that? That all makes sense?
Yeah, it does. How can you check that? Just check the glands on the throat?
You can just look into the mouth if it's red and swollen and there's pus there or there's anything like that. But then also, secondly, you can feel, it feels like sand build up in a stocking if there's all lymphatic and infected product there. You can massage that away, and the drainage of the nose goes from here across to here, down here, so you can manually wipe that away to stop that infection staying there, and you drain it down the throat, and then the ear will equalize. You can do a little bit of traction here to help that move, but they're all things that your chiropractor or health practitioner can show you, or you start practicing to see when they're healthy what it feels like in there. The tissue should be soft and pliable, not hard, but you've got to learn how to massage that and get the children used to doing like the combing of that mucus away. It's just below the skin surface, so it's not hard to do. You can't really hurt them. You just got to learn those things. Usually when they're healthy, get a feel for their body so that you know when it starts to feel puffy that you drain it away. And then there's herbs and vitamins like thyme and rosemary and oregano that dry up mucus that you can put in their food. Or you can burn in an oil burner which coats that area and helps to dry and clear infection away.